Hi, friends. Today we are going to talk about high sugar, high insulin, and high inflammation. In my experience, people often do not understand the connection. They know in lay terms that yes, the more sugar you eat, the more inflammation you're going to have. And I see that quite often talking to my clients about that. So I decided to cover this topic. We will be talking about, number one, high sugar and bacterial infection, high sugar and insulin effect on the body, high sugar and aseptic inflammation. And it's not only inflammation, high sugar will contribute to cancer spread and cancer formation. As I said, it does not come too often on here on my YouTube channel, but my clients do ask this question and I want to explain this concept. So yes, you can contact me to be your health coach, and here is the information, and it all will be in the description below. So let's go to the blackboard for explanation. So when we eat a high sugar diet, let's remember this is our digestive tract as always. So we put the sugar right here into our mouth. All the sugar is broken down into smallest particles and eventually get absorbed through the digestive tract into the bloodstream and get delivered with the bloodstream. So here is the pieces of sugar. With the bloodstream, it delivered into every single individual cell in our body. And this is the cell. And the cells will use the sugar as a source of energy. Bacteria love sugar, especially pathogenic bacteria. When in the areas where the body comes into contact with environment, it could be any place like digestive tract here, in the mouth, and could be in the rectum. It could be vagina. It could be eye. It could be nose. It could be posterior throat right here. So every place where the bacteria can come here inside our body and sit right here, that sugar will get delivered into those cells right here. And the concentration of sugar will be high here. And that will promote bacterial growth right here at that end organ. So a person will have bacterial inflammation, such as bacterial conjunctivitis, vaginosis or vaginitis, sore throat, different infections. So we talked about point number one, high sugar and bacterial inflammation. Now, let's talk about sugar and insulin. So when you think about sugar mathematically, let's draw a table here. So this is the time, okay, and this is the concentration of sugar. When we eat high sugar diet, so it's immediately simple sugar get absorbed here into the bloodstream, and the concentration of sugar is high here. What that means that concentration sugar in a short period of time goes really high. Body cannot tolerate, or physiologically, it's not supposed to be this way. So we have insulin that get produced immediately. Let's draw insulin here. Insulin kicks in. And because of the sugar and insulin get combined, insulin drives sugar, that sugar, inside the cell. Sugar drops dramatically. Insulin does not drop dramatically. It's a kind of, it takes time before it goes down. As a result, the insulin stays high for a while, and usually it's even overshoot. Insulin has a positive effect on our body. It's anti-inflammatory substance. Yes, we love in benign prostatic hyperplasia, high insulin is actually a good thing. However, in this particular case, you need to understand this high insulin drives sugar down. When sugar goes down, there are many physiological mechanisms that prevent sugar from going down. People may say that, oh, I cannot function. I have a low energy. So low energy. Some people, if they don't have extra storage in their liver, actually can feel dizzy. So Insulin subsides almost immediately after that, and this sugar have to be fixed. At this point, we have cravings. You want to grab something. It's a very dangerous situation. People with diabetes type 1 and type 2, they know that low sugar can cause death. And people who don't have diabetes 1 and 2, they actually can faint. It cannot happen, or if it's happened, everybody will know that you are not well. So, but at this point, when sugar is this low, you want to eat. So, and what you do, you reach for some sugary snacks, usually pizza, pasta, bread, cookies, candies, all of that sugar spikes, and then insulin spikes again after that, and it's again overshoots. But there is always time lapse between high sugar and high insulin. So this sugar promotes bacterial growth, and then it will drop again because of high insulin. Insulin will stop dropping too. This, as you can see, roller coaster, high sugar, low sugar, high sugar, low sugar, high insulin, low, high insulin, low, is not such a good idea. Body cannot tolerate that, and the person becomes unwell. So we covered with you point 1, high sugar bacterial infection and spike of insulin. Let's go to the point 3, aseptic inflammation. So when the dietary sugar becomes high, sugar gets pushed inside the cell, and it's used by the cell to produce energy. The sidekick of that is creating of reacting oxygen species. This is aggressive oxygen. It actually activates specific receptor called toll-like receptors. This receptor activates several different pathways, among them activation of piece of protein called P65, which drives the inflammation. And there's a lot of research on the topic of P65 in breast cancer, which promotes cellular growth, promotes cellular proliferation, angiogenesis, and metastasis. So activation of toll receptors promotes P65, and that affects our genetic information. Here you can see our nucleus with DNA, and as a result, activation that creates inflammatory substances such as interleukin-6, interleukin-1, and tumor necrotic factors. All of the substances get released into the blood, and that's when we are talking about a person has such a high level of inflammation in the body, and it's expressed as a septic inflammation. Bacteria, you can see from this picture, is not involved at all, but there is an overall inflammation in the person, and such autoimmune condition, rheumatoid arthritis, systemic lupus erythematosus, cancer. This reactive oxygen species and interleukin-6 and tumor necrotic factor contributes to inflammation in the atherosclerosis and cancer. So let's say a few words. Oh, by the way, I want to tell you a story. I consulted a person with BPH, benign prostatic hyperplasia, and recommended some supplements, and person took those supplements quite successfully. So he improved. But when we talked about the diet, I realized person eats high sugar diet, and prostate as a complex structure, and it has some fibromuscular portion. When inflammation gets stuck there, it's very difficult to get there. So when person took the supplements, he said, oh, in 3 weeks, I get 80% better. I want to be 100% better. We talked about the diet, and I realized that the diet is high in sugar. So that sugar promotes aseptic inflammation in the prostate. As a result, I told the person that you have to cut down on simple carbohydrates. You may take supplements, but it's not going to have a long-lasting effect the way that when you took supplements, you change your diet, and then you can actually discontinue supplements, because this is the final goal, to discontinue supplements and live without them. So you need to cut down on sugar. What do you cut on? Bread, pasta, pizza, juices, ice cream, cookies, and candy. That's, guys, you heard that. 3 points about high sugar, septic inflammation, aseptic inflammation, and fluctuating sugar and insulin. That's it for today. If you need more information, all links below. Contact me. Also, there's a link below. Like, subscribe. Bye-bye for now.